Welcome to ADC Endoscopy Center. We are located at 8209 Amarillo Boulevard West, number 1 Care Circle Drive. You have been scheduled for either a colonoscopy, a flexible sigmoidoscopy, or an esophago-gastroduodenoscopy, better known as an EGD. A staff member from ADC Endoscopy Center will call you the day before your procedure to remind you of your appointment. You will be called on Thursday if your procedure is scheduled on a Monday. An endoscope, or scope for short, will be used for these procedures. It is an instrument which will visualize the inside of your colon, esophagus, stomach, and duodenum. This scope contains a camera and a light for visibility. There is a special port on the scope that allows the doctors to pass instruments needed to take biopsies, remove polyps, and inject medication if needed. Sedation medications are given to patients to help relieve pain, anxiety, or movement throughout the procedure. The type and amount of medication is ordered by the physician. Some people feel that they are completely asleep, while others are comfortable through the procedure. The amount of medication used will depend upon the procedure and your health history. If you have any allergies to Demerol, Versed, fentanyl, or Phenergan, please inform your physician and the nurse admitting you to the center. In a colonoscopy procedure, the physician passes a small scope through the colon to look for any polyps, colon diseases, or cancer. You will be required to take a preparation or prep to clean the bowels prior to the procedure. Your physician or his nurse will give you instructions on the type of prep you are to take. The prep will cause you to have multiple bowel movements and result in liquid stools. Your stool should become clear and may be light yellow or green. If you do not see liquid stools or are unable to take the prep, contact your physician as soon as possible so other arrangements can be made. You will also receive instructions on which foods or liquids you may eat or drink 1 to 2 days before your scheduled procedure. For your safety, you will be asked to stop eating or drinking those foods or liquids at least 4 hours prior to your procedure. In a sigmoidoscopy, a scope is passed through the rectum into the lower portion of the colon. The physician will be looking at one portion of the large bowel. Your physician or his nurse will give you instructions on preparing for this procedure. You may receive sedation prior to this procedure, which may require that you have someone available to drive you home after. In some instances, you may not receive sedation and will not be required to have someone drive you home. An EGD is a procedure in which the physician passes a scope through the mouth into the esophagus, stomach, and top of the small intestine. Your throat is sprayed with a topical anesthetic. Be sure to inform your nurse if you are allergic to lidocaine. You will be given instructions by your physician or his nurse on preparing for this procedure. Those instructions will include information about taking your current medications and the time you must stop eating foods or drinking any liquids. For your safety, you will be asked not to eat or drink at least 4 hours prior to your procedure. The procedure in which you will undergo will allow us to perform a biopsy. A biopsy is a procedure in which a sample of tissue is taken from inside the colon, esophagus, stomach, or duodenum. The sample will be sent to pathology for testing. Your physician may find a polyp or growth inside the colon or stomach. The physician may remove these growths using several techniques. The sample may be collected and sent to pathology for further testing. The following are some things you can expect the day of the procedure. Arrive at the endoscopy center at the time given to you by your physician. This time is approximately 1 hour before the procedure is to start. Bring a list of all the medications you are taking and the dosage of each. Be sure to write down any allergies to medications that you may have. You will need an adult with you to drive you home after your procedure. You will not be allowed to drive yourself home. Leave all jewelry and valuables at home. Only bring money for any copay you need to pay. Bring your glasses if you need them to read when filling out forms and signing permits. Bring a pair of socks. If you use a CPAP machine at home, bring it with you to the center. If you use oxygen, please inform your nurse. Upon arrival to the endoscopy center, you will be greeted by our receptionist. She will request a copy of your insurance cards and any copays required. She will give you several forms to fill out and to sign. You will be given a copy of our patient rights and the HIPAA privacy policy. Upon admission, a nurse will take you to our admission area to prepare you for your procedure. Your blood pressure, temperature, and other vital signs will be taken. You will be asked about pain of any kind. The nurse will go over all forms, including the consent form, the discharge instructions, and your personal history. Your medications and allergies will also be reviewed. You will be asked to sign consent forms for the procedure, blood transfusions, as well as sedation during the procedure. The consent forms include the following: physician's name, reason you are having the procedure, consent to be given blood if needed. You may also choose to refuse blood, consent for sedation, risks of the procedure, risks of receiving sedation, risks of receiving blood or blood products. After all forms are completed, you will be asked to change into a gown and get into bed. Your clothes will be placed in a bag and placed under the stretcher. They will remain with you at all times. An IV will be started so you may receive IV sedation. We prefer to start the IV in the right hand. Please inform the nurse if this is a problem for you. An assessment will be completed by an RN. Your family member or the adult taking you home may come to sit with you after your admission is complete. We allow one visitor at all times. Please give any valuables to your family or friend at this time. Please also feel free to ask any questions you may have at any time during the admission process. Upon preparing for the procedure, the nursing staff assigned to you will take you by stretcher to the procedure room. Your family or friend will be shown to the waiting room to wait while you are in the procedure. Monitors will be placed on you in order that we may take your blood pressure, heart rate, and oxygen saturation. You will be placed on a small amount of oxygen through a nasal cannula. Next, your physician will greet you in the room and may ask questions. He will also answer any questions that you may have. A timeout will be called before your procedure is started. The timeout is to verify your name, procedure, and physician before you are sedated. The RN in the room will monitor you throughout the entire procedure. Medications will be given by doctor's orders throughout the procedure. The amount of medication you receive will vary. The medications most commonly used are Demerol, First Aid, fentanyl, and Phenergan. Please tell your nurse if you have any allergies to these medications. After you are comfortable, the physician will perform the procedure. Your procedure will take an average of 30 to 45 minutes. During the procedure, the physician may take biopsies, remove polyps, or perform treatment. A report will be sent to the physician from pathology if any specimens are sent out for testing. Your physician's office will give you the results. Your procedure may be stopped if you are having a colonoscopy and the colon is not cleaned out, or if you are unable to tolerate the procedure. Once the procedure is complete, we will take you to the recovery area where you will remain for at least 30 minutes. Your procedure nurse will report to the recovery room nurse who will be taking over your care. The nurse will take your temperature, vital signs, fill out an assessment, and ask you about your pain level, if any. At this time, your family member or friend will be able to sit with you at your bedside. The physician will come to your bedside to talk with you after the procedure, and the nurse will follow your post-procedure physician orders. You will be given fluids to drink unless the physician has ordered otherwise. The recovery room nurse will prepare you for discharge. Upon discharge, the nurse taking care of you will take your vital signs and will ask you again if you are having any pain. Your discharge instructions will be reviewed with you and your family member or friend. Any appointments, Prescriptions or special instructions will be given at this time. Please remember to feel free to ask any questions at any time. Your discharge instructions will include all of the following. Do not drive or operate machinery or heavy equipment for 24 hours. Do not drink any alcohol for 24 hours. Drink plenty of other fluids. Avoid eating any foods that are greasy or spicy for the first meal. Call your physician if you experience severe abdominal pain, nausea, vomiting, or bleeding. Any special instructions from your physician will be written on the discharge sheet. Your IV will be taken out, and we will ask that you hold pressure on the IV area for 3 to 5 minutes. You will be given your clothes to change back into. Your family may stay and help you with this. After you are dressed, your family member or friend will be asked to bring the vehicle to the driveway at the discharge door. We will take you by wheelchair to your vehicle. You may still be very sleepy when you are discharged to home. You may not remember talking with the nurse or the doctor and being given fluids to drink. You are encouraged to go home and rest for the rest of the day. Shopping or going out to eat is not advised. An ADC endoscopy staff member will call you the day after your procedure. You may also call us or your physician's office at any time if needed. A survey regarding your stay with us will be conducted either by phone or mail. Please let us know if we provided anything other than excellent care. We understand that you have a choice in health care, and we would like to thank you for choosing ADC Endoscopy Center for your procedure.